The following program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.
And guys, correct. It is 11:06. Welcome to it. We are here live once again on your Saturday morning. Yeah, it's going to be a steamy one. It's going to be beautiful. Get out there and enjoy it and hydrate like crazy. And you can continue to enjoy it. 416-870-6400. 416-870-6400. That is the number to call in. You have some concerns with your personal health. Give us a call. Let Dr. Lou talk to you. Bring it on. And that's why we're here. The phone calls, the live phone calls are what makes the show. There is questions, and we got some answers. 416-870-6400. Info at pinpointhealth.ca. The clinics are open, of course. They're helping people. They're servicing people. You want to reach out to pinpointhealth.ca to find one near you for a wee chat or a consultation with one of Dr. Lou's team anytime would be advisable to do so if you're having some issues. But we're going to get into it here at, 7 minutes after 11 on Saturday morning, pal. What's going on today? What's on your mind?
What's going on today, John? It's another day. I think the way you're starting the show is always my favorite way about having people call in. I love interacting with the callers, seeing if there's any clarity I can provide. Sometimes I have to be pretty generic because I obviously can't diagnose people over the radio. But, I think a lot of the times, I think I even mentioned this last week, is a lot of the times the things that you're experiencing are probably being experienced by thousands of other people listening. So it's usually a question that's applicable to more than just you. And having a little bit of clarity on some of the right steps could provide a big benefit towards your outcome, towards getting better, because I think that's everybody's goal when you've got something going on, is exactly, what is it that I can do going forward to take care of this. A lot of the things that will happen to people are issues that are a result of, sort of what they do in their day-to-day lives. I can think of this week, I was speaking with somebody who's actually an electrician, and they were talking about, the work that they do, and it creates the shoulder issue that they have, and they can totally appreciate that, when they're on weekends or vacations or things like that, they don't feel this issue whatsoever. But then when they're at work, they're doing what they have to do. It's inevitable. They sort of have to use their shoulder for what they're doing. And there's issues there. And so we were able to look at this and look at, okay, well, here are some simple ways that you can modify. Here are some simple ways that you can take a break at different points. And also here are some different exercises that you can do to strengthen your shoulder that will help you with those particular movements. I followed up with them. Actually, this was a follow-up. And they said that just those simple recommendations around a lot of what they could do was helping tremendously. They, at some points, if there was excessive overuse, there was still the sore shoulder, sure, but not the way that it used to be. And that sort of really highlights, I don't want to say the magic, but, people always come to me thinking that I've got some magic cure or something like that. And I don't. The closest thing that I have to magic is very good science. And with that good scientific evidence, good clinician experience, good outcomes that I've seen with other patients, I can make recommendations that oftentimes can make a big difference. And it's incredible how many people are very realistic in their expectations. Like, to be completely cured, like working with this individual, he understood that the reality of his job meant that no matter what, this was never going to be something that was 100% gone. But what were some ways that he could manage it, make it more easy to live with so that he could finish his job, not go home, be in soreness? And we were able to do that. And that was a very realistic expectation, which is why one of the things that I go through with people in my initial examination with them are, what are your goals and expectations? What is it that you're actually looking for out of this? And some people will say, well, I want it to be completely gone and I never want to feel it again. Very few people say that. That's when I've sort of got to put on, the reality hat and say, okay, that may not be realistic. Can we get it to a point where it's not affecting you day to day? You're able to manage it? Yeah, probably. And other people have very simple goals. Sometimes when I see people who are elderly, and an example of, say, spinal stenosis, and you finish explaining to them that this is a progressive type of disease, it's not necessarily going to reverse, excuse me, but there are ways that you can improve your mobility. And I say, some of these people can barely walk 50 steps. And that's the reality of their situation. And sometimes their goals are as simple as, I just want to be able to move around my house pain-free. And, if I've got to go to the grocery store and pick up some stuff, and those are more realistic expectations. So it's really important in that process that people go through what goals and expectations are between the patient and the practitioner, the healthcare professional, in order to really determine what the best approach is, and also to understand that there's got to be a realistic expectation. There's got to be realistic goals, and then sometimes the goals can progress, right? Sometimes it's like, okay, well, we might be able to get there, but I think a better short-term goal is how do we increase your mobility? Like if we're talking about pain, and that may not be the thing that you can target first. First, you might need to be targeting mobility, range of motion, and then eventually we can target pain. So this is the beauty and really the art. I speak about the science, but there's also an art to having a conversation with a person, speaking with them, and realizing what those realistic goals and expectations are. And that's something that I really pride myself in. What I try to do with all of the patients that I see is setting this up the right way so that, there's no false hope for anybody that, and most people that come to me, a lot of people will bring their loved ones to me and they'll say, I brought, my mom or my dad or my kid or whomever it may be, for the very reason because I've heard you on the radio and I know you sort of give a no BS type of approach to this, and you're going to give it the way it sort of is, in a, obviously a respectful manner and whatnot. But I want to make sure that when I'm speaking to patients, and even when people are calling into the show, I think anybody that's listened to the show over the years knows the way I interact with the callers is very much real talk. I try to give it as real as possible in terms of, what I think the issues are, what may be going on, some of the things that can help. But that's really what people need. And I get so many people that come see me and are hoping for, some silver bullet or something like that. And I just always tell people, be careful if that's what someone is selling, because if it existed, everyone would know about it for musculoskeletal pain, but it doesn't exist. A lot of this is really good management, good advice that will really empower you, the person dealing with it, to take care of yourself.
Yeah, so I think people, and we've talked about this on the show as well many times, is they just don't want to put in the homework when it comes to doing a lot of these things. And I know you every time you have a consultation, meet with somebody, if it's something that you can fix and, somebody in one of your clinics can take care of, there's also the onus on the person who's suffering to, put your nose to the grindstone and really do what is told and what is expected of you to get better. And I think that's more than half the battle, is getting them to do the work on themselves, right?
Yeah, absolutely. There's multiple avenues when you're undergoing care, right? In healthcare in general, this doesn't even just apply to the musculoskeletal care. In fact, it's sometimes easier to use examples that are non-MSK related. And if we use the example of heart disease, right? Now, of course, you're going to go see a cardiologist. They might have you on some medications. They may be doing some specialized procedures to monitor you, things like that. But a lot of the advice that the cardiologist is likely giving in those scenarios is lifestyle, and which includes diet and exercise and doing those things, because, you've got to take care of yourself. And it really is no different when you're dealing with, something like back pain. The notion that you can go somewhere and that person is going to cure your back pain or get rid of it and you're not going to really have to do anything, that's wrong. That's not really what happens. It's very, very much analogous to the example of the heart disease that I'm giving, or if someone was diagnosed with diabetes or whatever it may be. Yes, there's a professional involved who has a specialized body of knowledge who can help with some of the treatment, some of the recommendations, the progression of exercises, etc. But really what ends up being required very much is the patient's part in their recovery. The patient has to be, educated on what are the right things they should be doing, what are the wrong things that they should be avoiding, what are the exercises and different things that they could be doing to better themselves. Does diet play a role in this? Does their work have a role in this? Are there modifications? That's all stuff that the individual will have to take care of, because the healthcare professional cannot be there with you at every single minute of every single day. All they can really do is use their expertise to help guide you through that path. And that's the reality of it. And you're absolutely right. When you're undergoing care for musculoskeletal injuries, aches, and pains, it's not just as simple as relying on the person providing the care. There's also a component that falls back to the patient who is then going to, in turn, have to be responsible for the self-care, which arguably at a certain level, at a certain stage of pain and injury, is even more important than the passive intervention that is being done by the professional, the therapist, whomever it may be. And that is very fundamental in managing these issues well. And we've talked about this, tons of times with examples like low back pain and people who call and have chronic low back pain. Once you're dealing with something that's been going on for years, it really falls more to the patient. I think I've mentioned that I work with a specialized program for low back pain in Ontario through the ministry. And, a lot of the people that I see that have chronic low back pain, it's really, modifying their lives, educating them, giving them education, exercises, all of those things. That's what's going to be the biggest help. And if you do it the right way, you follow the science, you follow the clinician experience. I've seen people who have come in very, very rough shape, and once they're really ready to turn it on and make themselves responsible for their low back pain, the improvements and the outcomes are tremendous. And people just do amazing things once that finally clicks, once there's that realization of, okay, what is it that I have to do on my own? Yes, I have this guy, this professional, whomever it may be, who's giving me this advice, but what am I supposed to be doing every single day of my life so that I can make this better? And when people do that, again, the outcomes are tremendous.
Yeah, you're not going to have your driving instructor beside you every day of the week. You got to learn how to take the wheel yourself eventually and learn how to drive, right? We're going to take a short break. I had a phone call there, Dave. If you got disconnected, feel free to call back. It is 416-870-6400. 416-870-6400. You got pain concerns, something's going on with you, maybe calling on behalf of someone else. That is fine. You got some time here on the Pinpoint Health Show. We'll continue on Global News Radio. Plenty of time, 416-870-6400, 416-870-6400, info@pinpointhealth.ca to reach out through email anytime. And want to remind you to catch the Lou Down, the long-form podcast with Dr. Lou with a variety of topics, a longer form to sit and learn some more stuff outside of this radio show and the phone call as well. We'll continue on here, pal. Which direction you want to go? By the way, 416-870-6400 for any concerns you have for the remainder of the show. Feel free to call us and have a chat. Take it away, pal.
Yeah. So, we finished that first segment and we were talking about the amount of responsibility that often falls on the patient in terms of getting better. And, I know that people don't like hearing that. And I know that I've, had plenty of people in my office who sit there, and I can remember one case in particular where I don't remember exactly what the particular issue was, but I know that it was a lot of self-care was the answer. And, I went through a ton of stuff that this person could be doing. And I remember at the end of it, once I finished talking for, however long I was talking for, 20, 30 minutes, having a conversation with this person, in summary, I basically said, so, is everything clear? And they looked at me and said, yeah, there's essentially nothing that can be done, was what they got out of it. And I sort of, I remember I had a resident with me who sort of looked and was like, oh my God. And I sat there and I was like, okay, let's start again, because if that is your perception, then maybe I haven't done as good of a job as I thought to get across what it is you could do. And, I basically, and some people are just, they put on their blinders when they want to put it on, right? So that's not the only time I've ever heard that, right? There's a lot of times where once you tell people what they could be doing, and because so much of it falls on what they need to do in terms of lifestyle, exercise, diet, modification of certain activities, whatever it may be, they hear that there's nothing that can be done, that there's no pill, there's no procedure, that is the answer. And, I think that paradigm has to shift, again, when it comes to musculoskeletal care, when it comes to aches and pains. For whatever reason, there's this perception that it's different than other aspects of healthcare, and that's why so often I'll use other examples, whether I'm talking about diabetes or something else, where I use those examples to really highlight, because I think that has become more widely accepted to realize how much the patient has to play a role in their health in order to better themselves when they've got these other types of chronic lifestyle diseases. But for, again, whatever reason, when it comes to the musculoskeletal health, There's this idea that someone else out there should have, some magical tool, pill, procedure, whatever it may be, that will be the be all end all. And it's not. And one of the reasons why I really try to hammer this message week in and week out, I know there's, tens of thousands of people that listen to this show. And I know sometimes I sound like a broken record saying the same thing, but I do genuinely believe that repetition is the mother of knowledge. And when people can really sit there, and I've had people who have come in and said, I've listened to you for years, and I know that you say that that it's got to fall on me to do it, and I'm ready to do that. I'm finally ready. And so, that is why I hammer on this so much. I go over and over again how much responsibility, because I think the more and more people hear it, at some point it just clicks where it's like, I think this guy's right. I think this is more something that I've got to deal with versus trying to rely on someone else to solve my issue. And it's not because someone else doesn't have the tools. It's because, again, nobody can be with you. You just said it before we went on break, John. Like your driving instructor isn't going to be there all of the time. They've got to instruct you so that way you're learning what you could do when you have to be driving. And it's the same thing when we use our bodies. What are the things that you could be doing to strengthen, to stretch, to whatever it may be, whatever combination, depending on the issue we're talking about, in order to make yourself overall feel better. But in all honesty, I just think when that thing finally clicks, when there's that light bulb that goes off, that they realize that they've got to be doing something, that is genuinely the closest thing to magic that happens, right? People always come in and, again, want these magic cures, and I always tell them that's the closest thing that you're going to get to magic is. And again, think about, use another analogy when people are in their weight loss journeys, or anybody that's tried to lose weight, and struggled over the years. Most people that you talk to that finally achieve it, they'll tell you that there was just something that clicked in their mind where they realized, because so many people want the quick fix, right? Like, is there a simple way? Like, people all the time, could acupuncture help you lose weight? It's like, well, not if you eat unhealthy and you don't exercise, right? And
Gotcha.
So people are always looking for these simpler tools, or, can I buy that shake and that will make me lose weight? And again, if you don't add in the fundamental basic principle of exercise and healthy diet, then no, you're not going to lose weight. But the minute someone has that click where they realize, okay, no, this is just going to require my dedication to do the things that I know I need to do and that everyone says I need to do, that's most people that have achieved that type of weight loss journey or whatever example of that. They'll tell you there was a moment that it clicked where they just became headstrong more than they became physically strong. And that's really a lot of the times the challenge in musculoskeletal health as well, that I try to motivate patients in, is right. You're dealing with a chronic issue at the point where you become headstrong, where it clicks and it's there. That's when really there's going to be the closest thing to magic happening. That's when you'll see drastic improvements and your outcome overall will change, and you'll just do so much better.
416-870-6400. James, thanks for hanging on for a couple minutes. Good morning. What is going on with you?
Morning. Trying to call for my wife to get her some assistance.
Okay.
She's had a problem with sciatica in the past, and she's had a sore ankle, and it sort of started mid upper leg and went down to her ankle and goes up to her sort of high leg. And she's been to some people. She's had recently an x-ray and ultrasound done, but hasn't been read yet. So she's tried a number of things with some rehab clinics, but it really hasn't done anything, and she hasn't had any particular incident that created the problem. It just started sort of mid-ankle and then went down, or mid-leg and went down to her ankle and goes up to her sort of lower butt.
Now, does it feel like a nerve pain to her? Like you mentioned, she's had a history of sciatic pain, so she's sort of familiar with nerve pain. Is that what it feels like?
I think so.
Yeah. Okay. Again, this is the most fundamental thing when I hear anything like this is not, I don't start at what the treatment is. What I start at is, well, what's the likely cause of what's going on? So, even if we were certain that we said, okay, it's sciatica, Sciatica is more of a clinical sign than it is a diagnosis, and simply because the fact that the question for a health professional like me becomes, well, what is causing the sciatica? Is it a tight muscle? Is it, some type of bony changes, arthritic changes in the spine? Is it a disc bulge? Is it something else somewhere else? That's the fundamental thing that you've got to look for first off, is what is causing the nerve pain. Sometimes it could be peripheral entrapment. Sometimes nerve pain can be a result of other things, diabetic neuropathy. How old is your wife?
She's 50.
And any other health concerns?
No.
No, otherwise healthy? Yeah. So, I mean, and how long has this been going on for now?
Currently, it's been a couple of months.
And you said she's been to some facilities. I guess the next thing that I'd want to know from her is overall, is she better, the same, or worse in comparison to when this all first started?
It's probably gotten a bit worse.
Yeah, okay. Well, so see, this is the thing where you're getting worse. That anytime a patient gets worse, that's when you've got to, go back to the reassessment, where you've got to be able, as a healthcare professional, say, okay, hang on, I might be on the wrong track here with what this is. Maybe there's even a deficiency in what they're doing, the rehab facilities. Maybe there's a deficiency in what your wife's supposed to be doing at home on her own. Like, the thing that I tell people is you could be getting the best care in the world, but if there's something that's creating that symptom in your day-to-day life, an example with people that have like muscular pain as a result of sciatica, a lot of the times it's due to sitting. And, they might go to get treatment and they say, oh, I feel great. But the minute I'm, back sitting all the time, I get this. And it's like, well, then the next thing you've got to do is build breaks or change your workstation, whatever it may be. So there's a lot of things that I guess where I'm trying to go with this is you've got to pick at all these little things to determine where is there something missing. And once you can find the place that's missing and what might be missing is the diagnosis is wrong. Maybe the plan of management is wrong, and a couple of other things. And so once you can figure out, okay, where is the hole? Where is the thing that's missing? Then you can plug that hole and you could say, okay, the diagnosis is wrong. Instead of it being this, it's actually probably more likely this. So here's what I want you to try for treatment, and then all of a sudden people get better. And I could tell you sciatica is one of those things that's notorious for this, where people think that all sciatica is a result of the same thing, and so they do one standard protocol of treatment for it, and not realizing that there's dozens of different things that can cause sciatic nerve pain, and you've just oftentimes got the wrong diagnosis. Now, again, I don't know that for sure in your wife's case, but that's where my head would start to go based on what you're saying right now.
Right, well, that's why we've been going to get an ultrasound and an X-ray to see if there's something else going on, because she never really had an incident.
Yeah, even the reliance on simple imaging like X-ray and ultrasound is likely not going to reveal very much.
Right.
Good clinical exams are far more important for this type of stuff than something especially like a low-level imaging technique like X-ray or ultrasound. I mean, I'm not really sure where they're ultrasounding and for what. X-ray, I would assume that they're probably going to X-ray the low back looking for degenerative changes. Your wife's 50, so she's going to have degenerative changes, right? And the issue that happens there is people get a report, the doctor sees it, says, okay, it says mild to moderate degenerative changes, so that's the cause of your pain. And most of the time it's not. Everybody at 50 years old is going to have mild to moderate degenerative changes. And to assess the actual, canals, you'll need special type of imaging to see if it's actually arthritic to the point where it's putting pressure on nerves. So in all honesty, I wouldn't be surprised if those two levels, low-level imaging techniques, don't actually provide that much more clarity.
Right, okay. Trying to, I guess, exclude other things, though, so...
Yeah, potentially.
It's been going on so long, it's trying to find something.
Yeah, for sure.
Thanks, James. Appreciate it. You want to reach out to 1-855-55-Dr. Lou, 1-855-55-Dr. Lou, DRLOU. Want to squeeze Mike in here before we break. He's been waiting for a couple minutes. Hey, Mike, good morning.
Yeah, good morning. Yes, I'm 74. I suffer quite a bit of different arthritis, pains, and I'm just also in the last year or so, I've had it in my fingers, looks like there's no blood flow going into my fingers, and I can't straighten them out, and things like that. I'm just wondering what's the idea of that, any ideas on this?
Well, if you're talking about blood flow, to me, I would say that this sounds like a vascular issue, which you'd have to be seeing a vascular specialist for that. That is not necessarily something as simple as muscle. Well, not that muscle joints and nerves are simple, but it's a different realm that can create pain and discomfort. But again, the descriptor of that, this is where something like Doppler ultrasound, looking at the vessels might be important. But I would say that if you're feeling that type of stuff and you think it seems to be vascular, I would start with speaking with your family doctor and then getting a referral to some type of vascular doctor to assess further. Prior to getting that, you'd probably need to get some ultrasound imaging done on different vascular structures to see if there's anything there.
Okay.
All righty.
That's about it, eh?
That's about it.
Thanks, Mike. Appreciate that. We got to let you go because I got to slide in a quick break here. And it's just that simple. Make that phone call and have a chat. Dr. Lou's here ready for the remainder of the show to take it. 416-870-6400. 416-870-6400. info@pinpointhealth.ca to reach out by email. And we'll take a short break. More of the Pinpoint Health Show is on the way. This is Global News Radio. That is always a good first move while you're listening. You can call. Indeed, we still got some time here this hour. Dr. Lou is ready to talk to you like we have our previous callers a few minutes ago. 416-870-6400, especially if it's something of the musculoskeletal nature, and then you want to make that phone call. It was interesting, a call or two back, Dr. Lou, where you mentioned that, imaging, X-rays, ultrasounds, MRIs. That is always, I don't know, because it's simply technology and people respect technology, but that is often, without proper advice, the go-to thing that people want. Oh, I want to, you might say, I want to have a look at your knee, and they'll physically, look at your knee and tell, no, I want to go for an MRI. It's going to tell me more. People automatically default to imaging. Why is that?
Yeah, so again, I think I'm going to focus on imaging when we're talking about it in relation to musculoskeletal health, because that's my bread and butter, my scope of practice, where I can definitely comment on the research. For whatever reason, I think you're right. I think people, there's the respect for technology. There's the idea that, it can see so much more than, some individual can see in their office. But again, anyone that works in this realm, chiropractors, physiotherapies, orthopedic surgeons, pain specialists, physiatrists, they will all tell you that a good clinical exam, and not only will they tell you, the research will tell you this too, where a good clinical exam, which is a combination of speaking to the patient and doing the detective work in combination with physical tests, to stress and test different structures in the area that you're concerned about, is often, 99% of what you need. Anytime imaging is indicated, it's often to rule out something else that can't be done with simple physical exam, or to just simply confirm what it is. Like, when we've had the orthopedic surgeons on the show prior, they could see a patient and talk to them and do a couple of tests and say, I'm, pretty confident this is a meniscal tear. I'm going to send you for an MRI. They send for the MRI, not because they're trying to determine, am I right or am I wrong? It's really about, if I'm going to go in there from a surgical perspective, I want to know what it looks like before I go in, and that way at least I can see some stuff in advance. So it's different than, they're not doing it to get the diagnosis as much as they are to get the specifics of the diagnosis in a way. And so that's the reality. There's this reliance. And the other big thing is people, and I have a tremendous amount of respect for family doctors because what they do is very, very difficult. They have to know a little bit about everything in health. So it's a tough job. It's not easy. And, one of the issues that happens, though, is because this type of stuff, so take the example of low back pain, it's one of the hardest things actually to treat because, so many people never actually get better from it, as I speak about all the time. And so, the doctor oftentimes, because they're sort of like, what else can I really do? Like this person, they've recommended them to go to therapy and the people don't go, and that's a big issue. And so they're not getting any better. And so they say, I'll send you for an X-ray, right? Thinking that'll make, and the patients often want that. And then the X-ray comes back and, you'll see a bunch of what we call incidental findings things that, sound scary because everything in medicine sounds scary, but at the end of the day is oftentimes, a variation of normal, call it. But then, because maybe the family doctor, who again is not a specialist in that area, sees these things and says, well, I guess that's the cause of your pain. And then people walk away saying, we get tons of people that come in saying, yeah, I've got back pain, but my doctor told me it's degenerative disc disease. I've got degenerative disc disease. That's, you hear that tons of times a day. And the reality is that it's probably not the case for your low back pain. The scientific evidence says it's a coin toss, right? Like you can have 100 people that have low back pain, and then you can x-ray them, and we know that 50% of them will have degenerative disc disease, but it won't be the same 50% that have pain. It actually doesn't line up. So it's a coin toss. You may have low back pain, and you might also have degenerative disc disease, but you're just as likely to not have degenerative disc disease. And you might have degenerative disc disease and have no pain whatsoever. So it doesn't really add up, and that's why the physical exam and the clinical examination by someone who specializes in this area is so much more valuable than those low-level imaging techniques. And there's a ton of guidelines out there that we follow on when we really think imaging may or may not be necessary. And yeah, John, you're absolutely right. Tons of patients, tons of people out there want that because they think because it's technology, it must be better than the individual. But not in this case. A lot of the times it's not in this case. And believe me, any health professional that thinks that imaging is warranted for something will absolutely send for it. That it's not like we try not to. We just try not to use it when it's not going to provide any more clinical information than we already have. Because a lot of these things, the example of an X-ray has radiation. So if we can mitigate the exposure to radiation and we know that it's not going to give us much more information, well, why expose the patient to that radiation if not necessary?
We have a few minutes to go, so that'll give you some time to grab a phone now. Right till close to the top of the hour is the time you got to make that phone call, 416-870-6400. Reminder that the Lou Down long-form podcast is available for you wherever you get your favorite podcast. The Lou Down is how you do that. And reaching out to Dr. Lou any other time, pinpointhealth.ca. We'll take a short break. Pinpoint Health Show right here, Global News Radio. 11:48, welcome back. Indeed, 416-870-6400, the number to call for the remainder of the hour. Alan, thanks for taking some time. Good morning. How are you?
I'm good. How are you doing?
Good, sir. What's bothering you?
Well, it's not me. It's my wife. She has this pain in her finger. Like she'll go to open the car door and she'll get this stabbing pain, and it's gotten worse over the last couple of years. And it's like she'll have to sit there and, for like a minute while the stabbing pain goes through her finger. And we're trying to figure out, what the heck it could be. And we're finding now that it's getting progressively worse. Like there's more things that are affecting it. Any idea what she should do, or?
Is it in one particular finger?
It is.
And which finger?
Her middle finger right there.
Her middle finger. And
yeah.
How old is she?
58.
58. And did she do anything where she used her fingers a lot for work throughout her life, like whether it was typing, sewing, I don't know, whatever?
Well, she's a programmer, so she uses it. That's like her mouse hand.
Right, yeah. Yeah, so this is one of those times when I was just talking about how arthritis often isn't the cause of pain. But in these instances, when we're dealing with smaller joints with hands, it could very much be that. Does the joint in that finger look bigger to you guys than it used to? Like, yeah.
Yeah, definitely.
Yeah, so that definitely sounds like it's the arthritic process that's happening, and the sharp pain is often, it could be like the bone-on-bone contact depending on movement. A lot of, especially females as they get older, that have used their hands a lot throughout their life for whatever work it was that they were doing, seem to get this. But yeah, that's that's a tougher one, right? This is where I would definitely start with an X-ray, right? Because I'd want to see, well, how bad is it in comparison to the other fingers? If it's not worse than the other fingers, then that brings me back to the drawing board where I say, well, if it's not as bad, if it's equal to the other fingers in terms of what we see on the imaging, why is this one the only one with pain? Or what you may very well see is, okay, yes, that one is far worse from a degenerative standpoint than everything else, and then that sort of tells you that's the issue. And then that becomes a management issue if that's the case. There's not a lot that can be done, but I would say this is where I would actually say starting with an X-ray is not a bad idea of both hands.
So it's a management thing. So you don't think this is something that could be corrected? It's probably
anything that is arthritic is never necessarily correctable. I mean, there's some surgical things that may reverse some of the changes, but degeneration is a progressive process that happens, from the minute we reach skeletal maturity. Our skeletons break down. And so, there's not a lot that can be done to reverse it. It'll mainly be management of it.
Yeah, she just pops a leaf every once in a while.
Yeah. And that's probably helps with any inflammation.
It does. Okay, well, thank you for your time. I just thought I'd ask.
My pleasure.
Awesome, Alan. Appreciate the call and your time as well. You want to reach out any other time to Dr. Lou, you can, 1-855-55 Dr. Lou, DRLOU, and the clinics are open, by the way, Dr. Lou, so people don't have to worry about, seeking help because you guys are there, full protocol in play. But you always have been, and you're always expanding as well as things start to get back to a little more normalcy. Looking forward to people coming back in throngs to the clinics and getting some help, right?
Yeah, of course. We've pretty much been going throughout all of this. In the beginning, the first initial lockdowns, we were sort of limited to acute and emergency care, and anyone that had more chronic issues, we were trying to do a lot of virtual stuff. But ever since, it was actually about June this time last year, I think, where we went back to normal care, and obviously with all of the, precautions that you can think of in place. Anybody that's ever interested in knowing what those are, visit pinpointhealth.ca. It's all there. I think everyone is sort of used to seeing this everywhere now anyway, so I don't think it's really all that unique. But, we've obviously upped our sanitization. The one thing that I always said was we were in healthcare, so we always sort of paid attention to this stuff about sanitization and safety. But, we've gone even further. And, the team is providing the care that people need. And, one of the things that I've noticed throughout the last year, I guess, at this point, is that when it came to musculoskeletal health and people were calling, say their family doctors and stuff, and they were sort of being told, okay, not serious enough to be seen in an office because it's not more emergent or whatever. And people have just sort of flocked to our clinics because they feel like it's a place where, I think people realize when it comes to these things, there's a huge benefit to interacting directly with the professional, right? Like if you've got an issue, you sort of want someone to say, like, my shoulder hurts. And I think most people inherently say, like, well, are you going to touch my shoulder to see what you think? Like, and that is really important, that, the testing happen and that you could put your hands on somebody to actually move the area around, poke and prod in different areas and try to determine the anatomical structures that are potentially affected. So, we've been doing that. My team is amazing. I thank them for doing what they've done over the last year, working as hard as they have in order to, again, keep serving the communities that we are in.
Got to wrap it up here in about 3 minutes or so. But in that regard, have you started noticing these seasonal injuries? I mean, now we're really starting to get to some heat in summertime. I mean, things people should be looking out for, or has anything come through your door that regularly does during summertime?
Yeah, I would just say this time, like all transition periods in the climates that we live, we go from doing certain activities to different activities because of the change in climate. And I guess what I've sort of tried to promote over these years, and we talked about it in the last few weeks throughout spring, is just really, gauge it, right? Like go slowly. Anything that you're getting back into, go slowly. If you're feeling something, get back into it. In terms of things that we see more often, I would say that more people during these times start getting back outside with running. So knee issues tend to be something that is happening. People start to do a lot of work around the house, so low back pain type of things, shoulder issues, all of the same. There's only so many joints in the body, and different and different things can all lead to different problems in different joints. So, I would just say as you transition into these new activities, do it in a way that's slow and progressive. And if you're feeling anything, get it checked out sooner rather than later. That, if there's ever one thing that I say that I try to get across the most is acute is always easier to treat than chronic. So deal with things in the acute phase.
There you go. Done for another week. Reach out to Dr. Lou and a member of his team across the clinics. PinPointHealth.ca. info@PinPointHealth.ca. The podcast available as well. The Lou Down and the phone number 1-855-55 Dr. Lou, DRLOU. Just that simple. We'll catch you again. Pinpoint Health Show, Global News Radio.
The preceding program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.